Okay, cholangiohepatitis is something that we see from time to time, and it's a very hard one for us to really diagnose because basically what cholangiohepatitis is, it's an infection that tracks up from the gut into the bile duct and affects the bile duct and the liver. So the intestine down here basically is attached to the liver via the bile duct, and normally bile comes out from the gallbladder and the liver down this bile duct and into the intestine. Occasionally, and there's a few reasons why this might happen, it might be due to bladder stones. More often than not, we don't really have a definitive cause, but the bacteria from the gut will track up into the bile duct and cause an infection here, which can go into the gallbladder and into the liver. So yeah, the main thing we tend to find with these dogs is just vaguely unwell, and we find it quite hard to really put our finger on why they're not well. They might have a slight temperature, they might have a little bit of discomfort in the front part of the abdomen, but generally it's just vague unwellness, and it might carry on for even a few weeks before diagnosis. So the way we diagnose this, blood tests. So we do a general blood test which will show signs of infection and show signs of some liver pathology. Depending on how severe things look and what exactly we see, we may also do an ultrasound, and the ultrasound is probably the best way to get a definitive diagnosis of this condition, because what we can quite often see on the ultrasound is thickening of the tissues in this region. We can see sludging in the bile, in the gallbladder. We can see if there's any stones or anything that we need to be aware of which might complicate treatment, and also it gives us a chance to potentially take a sample from the gallbladder. So using ultrasound guided needle, get a sample out, see what sort of infection we've got, and then based on culture and sensitivity, we can actually choose the most appropriate antibiotic. This is something which normally responds quite well to antibiotics, but we need to make sure we're using the appropriate drug at the appropriate rates, and making sure that we're going to get a quick response, because left untreated, this can cause quite a lot of damage to the liver.